Let's talk about something almost everyone does, but few feel comfortable discussing openly: masturbation. It's one of the most natural human experiences, yet it's surrounded by more myths, shame, and misinformation than nearly any other aspect of our health. Well, I'm Dr. Nerea Wolf, urologist and pelvic surgeon, and if you've ever had questions or concerns about your urological or sexual health, I want you to know you're in the right place. We're here to help you understand your body with clarity, compassion, and science-backed information. No judgment, just honest conversation. Today, we're going to explore masturbation from a medical perspective. We'll look at what it does for your body, what it doesn't do, and most importantly, we'll clear up some of the biggest myths I hear in my practice every single day. Because the truth is, understanding this part of your health can actually improve your overall well-being, your confidence, and your intimate relationships. So let's dive in. First, let's acknowledge something important. Masturbation is incredibly common. Studies show that over 90% of men and about 75% of women report masturbating regularly. That means if you do it, you're far from alone. And yet, despite how widespread it is, there's still so much confusion and shame around it. Why is that? Part of it comes from outdated cultural messages. For generations, masturbation was painted as something shameful, something that would harm you physically or morally. And while cultural and religious beliefs vary, and I absolutely respect personal values, the medical facts are clear. Masturbation, when done in a healthy way, is not harmful. In fact, it can be beneficial. Let me explain what I mean. When you masturbate, your body releases a cascade of feel-good hormones: dopamine, oxytocin, serotonin, and endorphins. These are the same chemicals that help regulate your mood, reduce stress, and even improve sleep. That's why many people report feeling more relaxed, more focused, or simply in a better mood after masturbating. It's not just about physical pleasure, it's about your brain and body working together to promote well-being. But beyond the immediate benefits, masturbation serves another really important function. It helps you understand your own body. It's a way to learn what feels good, what doesn't, and how your body responds to different kinds of touch or stimulation. And that self-knowledge, it's incredibly valuable when it comes to communicating with a partner. You can't really tell someone else what you enjoy if you don't know yourself first. Masturbation is also, without question, the safest form of sexual expression. There's no risk of sexually transmitted infections, no risk of unintended pregnancy, and no pressure to perform for someone else. It's just you, your body, and your own comfort. Now, all of that said, I want to be clear. Not everyone masturbates, and that's okay too. If it's not something you're interested in, or if it conflicts with your personal or religious beliefs, there's nothing wrong with that. What matters most is that you feel comfortable with your own choices, and that those choices are based on accurate information, not fear or myth. So let's talk about those myths, because I hear them constantly, and it's time we address them head on. Myth number 1, masturbation will make you go blind or cause hairy palms. Let's just get this one out of the way. It's completely false. If masturbation caused blindness or hairy palms, we'd have a global health crisis on our hands, given how common it is. This myth has been around for centuries, often spread by religious or moral authorities who believed masturbation was sinful or represented a loss of self-control. But medically, there's zero evidence. Your vision is not affected. Your palms are not affected. This is simply not how the body works. Myth number 2, masturbation causes erectile dysfunction. This is one of the most common concerns I hear, especially from younger men. Dr. Wolf, I masturbate almost every day. Am I ruining my ability to have sex? The short answer is no. Masturbation does not cause erectile dysfunction. In fact, it can actually support healthy sexual function. Here's why. When you masturbate and reach orgasm, your pelvic floor muscles contract. These muscles play a crucial role in sexual function. They help you achieve and maintain erections, and they're essential for orgasm. So in a way, masturbating is like exercising those muscles. The more you engage them, the better they work. That said, there are 2 important caveats I need to mention. Caveat number 1, pornography use. We've seen a rise in erectile dysfunction among young men over the past couple of decades, and it correlates closely with the widespread availability of internet pornography. Watching pornography, especially frequently or excessively, can desensitize your brain to normal sexual stimulation. It can create unrealistic expectations about what sex should look like, how bodies should respond, and how quickly arousal should happen. And when reality doesn't match those expectations, it can lead to performance anxiety. You start worrying, why isn't this working the way it does in videos? That anxiety alone can interfere with your ability to get or maintain an erection, And once it happens once, the fear of it happening again can create a vicious cycle. So if you're experiencing erectile issues and you use pornography regularly, it might be worth taking a step back and seeing how your body responds without it. 2. Guilt and shame. If you feel guilt or shame around masturbation, whether because of religious beliefs, cultural messages, or personal values, that emotional weight can absolutely affect your sexual function. Guilt has been linked to anxiety, depression, and sexual dysfunction. And here's what I want you to hear. If masturbation makes you feel bad, it's okay to abstain. But if you want to explore those feelings and work through them, a sex therapist can be an incredible resource. You deserve to feel at peace with your own body. Myth number 3, masturbating too much reduces your sensitivity. This one's a bit more nuanced. Masturbation itself doesn't reduce sensitivity, but the way you masturbate can create habits that make it harder to respond to other kinds of stimulation. For example, if you always use a very firm grip, or if you only orgasm with a certain type of vibration or motion, your body can become accustomed to that specific sensation. And when you're with a partner, or when you try something different, it might be harder to reach orgasm because your body is expecting something else. This is especially common with what's sometimes called death grip syndrome, where men use a very tight grip during masturbation. That level of pressure can't be replicated during intercourse, which can make it difficult to orgasm with a partner. The solution? Vary your technique. Use a lighter touch. Try different motions. If you use devices or toys, experiment with different settings. The goal is to keep your body responsive to a range of sensations, not just one. Myth number 4, you can masturbate too much. For most people, this isn't true. Even if you masturbate daily, that's generally fine as long as it's not interfering with your life. The time it becomes a problem is when it starts affecting your daily functioning. If you feel a compulsion to masturbate that you can't control, if you're skipping work or social activities to masturbate, or if you're avoiding intimacy with your partner in favor of masturbating alone, those are signs that something deeper might be going on. In those cases, it's worth talking to a therapist who specializes in sexual health. Interestingly, in some medical contexts, we actually recommend regular masturbation for men with chronic pelvic pain or testicular discomfort. Masturbating a couple of times a week can sometimes help relieve tension and reduce pain. So again, context matters. Myth number 5, masturbating means you have a bad relationship. This is absolutely not true. Many people in happy, healthy relationships still masturbate, sometimes separately, sometimes together. It's not a reflection of how much you love your partner or how attracted you are to them. Masturbation is a form of self-care. It's a way to explore your own body, relieve stress, or simply experience pleasure on your own terms. It doesn't replace intimacy with a partner. It can actually complement it by helping you stay in tune with your own desires and responses. Myth number 6, masturbation lowers testosterone. There's no scientific evidence to support this. In fact, during masturbation and orgasm, your testosterone levels actually go up temporarily. Afterward, they return to normal. Your body doesn't lose testosterone through masturbation. This myth has been around for centuries. Ancient Greek and Roman athletes believed that abstaining from sex before competitions would make them more aggressive and focused. Modern athletes have sometimes done the same, but the data just doesn't support it. You're not hurting your testosterone levels or your performance by masturbating. So what does all of this mean for you, practically speaking? If you masturbate and it feels good, if it doesn't interfere with your life, and if it doesn't cause you distress, then there's no reason to stop. You're not harming yourself. You're not damaging your sexual function. You're simply engaging with your own body in a natural, healthy way. But if you're experiencing issues, whether that's erectile dysfunction, difficulty orgasming with a partner, or feelings of guilt and shame, it's worth examining the context around your masturbation habits. Ask yourself, am I using pornography frequently? If so, how is it affecting my expectations and my real-life experiences? Am I masturbating in a way that's very different from how I'd be intimate with a partner? Do I feel guilt or shame afterward? If so, where is that coming from, and is it something I want to address? If you're struggling with any of these questions, you don't have to figure it out alone. A urologist, a sex therapist, or a counselor who specializes in sexual health can help you work through these issues in a supportive, non-judgmental way. And if you're in a relationship and you're worried about how masturbation fits into your intimate life, talk to your partner. Open communication is one of the most powerful tools you have. You might be surprised to find that your partner has similar questions or experiences. Here's what I want you to take away from today's conversation. Masturbation is not something to be ashamed of. It's not harmful when done in a healthy, mindful way. And for most people, it's a normal, beneficial part of sexual health. But like anything else, context matters. If it's causing you distress, if it's interfering with your life, or if it's creating problems in your relationships, those are signs that something needs to shift, and that's okay. There's support available. Your body is yours. Your sexuality is yours. And you deserve to feel comfortable, confident, and informed about how you care for yourself. If you ever have questions about your urological or sexual health, whether it's about masturbation, erectile function, pelvic pain, or anything else, please don't hesitate to reach out to a trusted healthcare provider. These conversations can feel vulnerable, but they're so important, and you deserve to be heard. Thank you for being here today. Thank you for listening with an open mind, and as always, take care of yourself because you're worth it.